we have this new guidelines with the European Academy of Neurology that published the guidelines describing the new advances in the pathogenesis and the updates in the treatment. We have the new lines for treating cluster headache, like involvement of the anti-CGRPs, antibodies, and this is, I think it's the new era in the treatment of headache in general, and specifically in migraine cluster headache. And following these guidelines, we can know which proper abortive treatment that we can use in cluster headache, because this carries the misjudgment sometimes of using the oral triptans, which will have this very short headache with a very long acting drug. So we usually use as an abortive treatment either the oxygen mask with a specific characteristic that it's 100% oxygen with non-rebreathable mask for 15 minutes. And we can use the triptans, but we can use the triptans using the intranasal or the subcutaneous, because, as I mentioned, it's a very short duration of the headache. So the oral are not used in the cluster headache. Also, non-steroidals, they don't have a role. And this sometimes adds to the medication overuse and the gastritis and the side effects from the non-steroidals, anti-inflammatory drugs, which will not add benefit for our patients. The other part of the guidelines is the prevention. We usually say that if we can prevent this headache, this disabling headache, this is a great success, because we have the two types of cluster headache, whether this is an episodic that happens in a part of the year, and we have more than 3 months between the episode and the other attack, and there is a remission period of more than 3 months, or the unlikely that the patient have the chronic cluster headache, which is a very severe attacks that have no remissions in between or a very short remissions. So the prophylactic treatment is very important in dealing with such patients. We can use the calcium channel blockers, the verapamil, topiramate, melatonin, the anti-CGRPs can be used, and this very strict guidelines will help us to help the suffering of the patient and have a very clear and proper evidence-based medicine use drugs for those patients.